Hello and welcome to part 2 of Anatomy of the Knee. I'd like to begin part 2 by discussing specifics of the knee joint. As you know, the knee joint is a very large and complex joint, and it primarily involves articulation between the femur and the tibia. So the condyles of the femur articulate with the condyles of the tibia. Technically speaking, the joint between the patella and the femur, or the patellofemoral joint, is also part of the knee joint because that patella articulates with the anterior surface of the distal femur. The proximal fibula is not part of the knee joint because it does not articulate with any aspect of the femur, even though there is a ligament that extends from the femur to the lateral proximal fibula. And you can see that here. But even so, the fibula is not part of the knee joint. The head of the fibula does articulate with the lateral condyle of the tibia, however, and you can see that here. That forms the proximal tib-fib joint. Okay, we will discuss the 4 major ligaments of the knee on the next slide. Okay. So the 4 major ligaments of the knee joint are the lateral collateral ligament, or the LCL, the medial collateral ligament, or the MCL, the anterior cruciate ligament, or the ACL, and the posterior cruciate ligament, or the PCL. So here is your ACL, here is your PCL, and then you've got the lateral collateral ligament here and the medial collateral ligament here. Okay, just to orientate you. The ligaments provide stability to the knee joint. The 2 collateral ligaments on the sides of the knee, here and here, are strong bands that prevent adduction and abduction. The 2 cruciate ligaments, seen here, cross each other as they attach to the intercondylar eminences of the tibia. They help to stabilize the knee joint by preventing anterior or posterior movement within the knee joint itself. Now, I'm not going to test you on the specific names or locations of the ligaments. Just please know that there are 4, and it's kind of interesting to see where they are and understand what they do, because so many of our knee injuries that we see often get referred to MRI, where they can better visualize these soft tissue structures. Okay, in addition to the major pairs of ligaments, there are a few other things I want you to just be familiar with. The anterior patellar ligament, okay, the anterior patellar ligament here, along with other minor ligaments, help maintain the strength of the knee joint. The patellar ligament is part of the tendon of insertion of that large quad muscle that we've been talking about, and that extends over the patella to the tibial tuberosity of the tibia. Also notice, this is interesting, the infrapatellar fat pad seen here, which helps protect that anterior knee joint. So again, we have fat pads all over our body. Kind of interesting. Okay. The cavity around the knee joint is the largest joint space of the human body. Kind of interesting. The knee joint, as we know, is a synovial joint. So synovial would be its structural classification, and it's enclosed in an articular capsule, or a bursa. And as you can see from the image on the right here, the capsule around the knee is filled with synovial fluid. In this image, the patient had an arthrogram, so contrast has been injected into the capsule around the knee. And notice they used positive contrast, which is white, and they used negative contrast, which is black. Negative contrast is usually air or some type of gas. Okay, next, notice the medial and lateral meniscus. And if we go back one slide, you can see the meniscus very nicely right here. Okay. They are crescent-shaped fibrocartilaginous discs between the tibial plateau and the femoral condyles. So right now we are looking down from the top at the top of the tibia. The menisci are thicker at the external margins, tapering to a very thin center portion. They act as shock absorbers to reduce some of the direct impact and stress that can occur at the knee joint. And if we go back to our next slide, the synovial membrane around the knee and the menisci themselves actually produce synovial fluid. And the synovial fluid lubricates the articulating ends of the femur and the tibia that are covered with a tough, slick hyaline membrane. So we learned about hyaline membrane a couple units ago. Remember, that is that cartilage that covers the ends of bones where they articulate or meet in a joint. So the synovial fluid around the knee joint really helps to lubricate those hyaline membrane surfaces, helps lubricate them for better movement. And as you can see, the potential for soft tissue injury to the knee joint is very high. Many of the activities that we enjoy, like sports, skiing, roller skating, can cause injuries to the ligaments or the meniscus of the knee. And as I said a minute ago, MRI is really the best modality to visualize any potential soft tissue injuries to that knee. Okay, so let's see if we can identify some of the anatomy that we just learned. So on the AP knee, that's what you see here on the left. A is pointing to the medial and lateral intercondylar eminences. And remember, we just learned that ligaments attach to those eminences. B, and this is kind of cut off here, but B is pointing to the lateral epicondyle of the femur. C is pointing to the lateral condyle of the femur. D, the lateral condyle of the tibia. E, the tibial plateaus. F, the medial condyle of the tibia. G, the medial condyle of the femur. H, the medial epicondyle of the femur. I is the patella, you can see it here. And then if we look at the lateral, A, remember, is the base of the patella. B is the apex of the patella. C is the tibial tuberosity. D is the neck of the fibula. E is the head of the fibula. F is the apex of the fibula. G is referring to the superimposed medial and lateral condyles of the femur. So they really extend this whole anterior to posterior stretch here. And then H is referring to the patellar surface or the intercondylar sulcus or the trochlear groove, any one of those three names. If we look at our next slide, there is an image of a rotated lateral knee here on the left, and then a tangential patella here on the right. On the lateral knee, notice that K is pointing to the medial condyle because I is pointing to the adductor tubercle. And remember the adductor tubercle, that is that little bump on the posterior aspect of the medial condyle. And so if you see adductor tubercle and you follow it down, this has got to be the medial condyle. The adductor tubercle is only on the medial side. So if you see it, this could never be the lateral condyle, okay? And we'll talk about this more in lab, but K is the medial condyle, I is the adductor tubercle, and J then has to be the lateral condyle. Okay, if we look at the tangential projection of the patella, A, of course, here is the patella. B is the patellofemoral joint space. C is going to be the lateral condyle of the femur. D is the patellar surface or intercondylar sulcus or trochlear groove. And then E is the medial condyle of the femur. I personally find identifying the condyles very difficult in this projection without a marker. So I would never ask you which condyle is which without marking this film right or left, just so you know. I think that's hard. Okay, finishing up, I just wanted to touch base real quickly on the classifications again of the lower limb. Remember, the knee joint is synovial and diarthroidal. The knee is considered a bicondylar joint, and the patellofemoral joint is considered a sellar or saddle joint. Perfect. So thank you so much for listening. If you have any questions, please let me know.